Good morning. My name is Aina Stoishunene, and I am the change manager for Iris. And I welcome you to the online training session on how to submit scientific advice request applications using the new online process via the Iris platform. This training is a live broadcast that is being recorded and will be published on the EMA website in the coming days. The objectives of this training is to give you a quick summary of the registration steps that you need to complete before you can prepare and submit an application via the Iris platform. The main focus of this session is to demonstrate how to use Iris to create and submit initial and follow-up scientific advice request applications. And at the end of the session, we will inform you where to find relevant user guidance or seek support for technical or business related questions. We hope that by the end of this session, you will be able to have a basic understanding of registration steps you need to complete in order to access Iris and submit your application. Understand how to use the Iris platform to create and submit a scientific advice application, and find the user guidance material and know who to contact for support. Before I give you a summary of the Iris registration steps to access Iris, I would like to give you a quick overview of the Iris platform in case you did not manage to attend the previous training session on the Iris registration process that took place on the 24th of September, and where we explained Iris in more detail. Iris is a secure online platform for handling product-related scientific and regulatory procedures. The platform is currently used for orphan designation and parallel distribution regulatory procedures, and very soon for scientific advice. Iris is also used to request briefing meetings with EMA's Innovation Task Force, and also for general procedures such as to request research product identifiers for new products or change of name and address of applicant for regulatory entitlements. The Iris platform comprises four components, so to say websites: a submission platform, which is accessed by industry stakeholders to submit the applications online, and evaluation and validation platform, which is used by the EMA staff to evaluate received applications. Then the European Medicines Regulatory Network users collaborate via the network portal to assess those applications in order to provide you with an outcome of the scientific application. And the fourth website is the SharePoint, which is a secure platform to store documents as well as collaborate on them. These four components are based on a suite of cloud-based Microsoft products, such as Microsoft Dynamics 365, Office 365, and so on. We hope that you will find Iris user-friendly, and it will help you to be more efficient than you need to submit scientific applications to EMA. Now, for you to be able to prepare and submit any application using Iris, there are a few registration steps that need to be completed prior to that. Important to note that the registration needs to be done only once, and then it will allow you to submit any type of scientific applications now and in the future. To access and use Iris, you have to have an EMA account. Your organization has to be registered in the EMA's Organizations and Management Service, OMS, and also you have to have an appropriate Iris user role. All these steps are performed outside of Iris in the EMA account management portal. Since scientific advice is a scientific procedure and involves a fee, you will also need to have a valid research product identifier and EMA customer account number. I strongly encourage that you refer to the quick interactive guide to IRIS registration process to understand the registration process better. And for more detailed information, please see the IRIS guide to registration. All of that is available on the IRIS website. Now, without any further ado, I hand over to Tarita Tofeksi, subject matter expert in scientific advice, who will give you a demonstration on the initial and follow-up scientific advice application submission using the IRIS platform. Over to you, Tarita.
Thank you, Aina. Thank you all for attending this training session. All applications for scientific advice will now be processed through IRIS. When I say all applications, initial and follow-up scientific advice and protocol assistant, including parallel consultation with UNETA, as well as initial and follow-up qualification procedure. So we will start by logging in on the IRIS portal. You can find the button on how to create a new submission in the Submissions tab. By clicking on Create New Submission, you can start the application process. I will initially demonstrate an initial scientific advice application. First, we select if we're applying as an individual or on behalf of an organization. For the purposes of this training, I will choose organization. The process is exactly the same if it is an individual selected. Then we have to select the organization name, location of the organization if there are more than one, submission type, and the manager for this procedure. Okay, so this is the submission form for initial scientific advice. As you can see, there are several tabs. In order to be able to complete the remaining tabs, you need first to complete the two that are highlighted. So we'll go first into the administrative information. The first thing that we need to enter here is the EMA customer account number. This number is needed for invoicing and is also needed even when a fee waiver is applicable. Then here you will be asked to inform us whether the applicant is registered as an SME in the EMA SME register. For the purpose of this demonstration, I will select yes to explain the various options. So once you enter the EMA SME number, you will be asked what type of SME is the applicant. So we have three options. The applicant is an EEA-based SME. The applicant is a non-EEA-based SME organization linked to an EEA-based SME consultant. And the applicant is an EEA-based SME consultant developing the product and not acting on behalf of any other organization. So if you select the first one or the last one, you do not need to fill in anything else as for this option. When you select a non-EEA-based SME organization, then you will be prompted to fill in the linked organization information. And this is because this is a requirement from the financial regulation in order to be eligible for the SME incentive. After selecting the SME type, you have also a prompt to let us know if the applicant is part of academia. This is relevant for certain types of fee reduction for prime or orphan designations. I will select no for this purpose. So as we have selected that the applicant is a non-EEA SME, then I will provide here some linked organization information that would be the EEA SME, that is the consultant, where the non-EEA SME is annexed. In the next section, we have a question with regards to an ad hoc fee reduction of, according to Article 9 of Council Regulation, number 297/95. There are some cases where the executive director grants ad hoc fee reduction. If you receive such a fee reduction, you can enter this information here. We expect to have a decision number and the percentage of the fee reduction granted by the executive director, which can range from 0 to 100. Following this, we require some information on the financial reference and contact point, and this is needed for invoicing. You can enter a purchase order number if applicable, then a financial contact person name and a financial contact person email, as well as a telephone number if you think. Okay, we can now proceed with the next section. So once the administrative information is filled in, we can proceed to the next page. The administrative information is the same for all process types. So in the next page, you will be asked to provide the primary RPI for this submission. You will see here in this, while by using the search button, you will see all the research products that are registered under your location. So as you can see now that the first two sections have been completed, you have links to provide the information on the remaining pages. If you would like to provide some additional information on the product other than the ones that are provided already at the time of RPI request, you can do so here. So you can provide additional information on the methodology, on the product, and an additional description. We would also like to ask you to add any relevant enabling technology. You can do so by clicking on the Add button. A list of records will appear where you can select or remove fields. Once you have selected all the enabling technologies that you think are applicable, you should click the please confirm that all relevant enabling technologies are included in the list above, and then by save and return, we can go to the next section of the application. If the advice relates to more than one product and you need to add an additional RPI, you can do so in this page by clicking on Add RPI and selecting the RPI from the list. In this UNT environment, there is no additional research product under this location. So I will skip this, but this is where you can add the additional RPIs. Then we proceed to the procedural information. Here you can provide the information on whether you require or not a preparatory meeting. If yes, you can tell us what is your preferred week or any other notes that you would like for us to be aware when organizing your preparatory meeting. Then you can provide information on the prime scheme, if there is a prime eligibility granted for this product, yes or no. In case of yes, we ask you to provide the prime number. Then we would also like to know if there is a PIP waiver decision granted by EMA for this product in the same or similar condition. By selecting yes, you can use the lookup. You should have a list of records according to the PIP waiver that is linked to your RPI. There is none here, so I will select no in order to proceed. And then you can also provide information on marketing authorization status. So if marketing authorization has been granted already for this product in the EU, yes or no. If it's a centralized product, here you will find the list of all the marketing authorizations. I will select no for this specific as the list is empty. You can list any mutual recognition, decentralized or national procedure number separated by comma. This is not a mandatory field. And specify all indications currently authorized, if any. And then we would like to know if you're planning to submit a marketing authorization. You can select any date and the planned route for the marketing authorization application. If you have received any previous national advice, you can let us know by adding information in the screen. As you can see, the sections that are completed have a green tick. The sections that are incomplete So let's go to the scientific information. We would like to have some information on the condition to be treated. So you can select these three options: treatment of, diagnosis of, or prevention. You can enter any indication proposed in this field. This is a free text field. You can write anything you like. And then we would like to have the same matching with the MEDRA. So the closest match. If there are additional indications, which in some cases is applicable, you can add a condition or indication here. Information is also required on the medicine profile. You have several options. You have 2 pages here. And we would also like to know if there is request concerns digital therapeutics or orphan similarity. If none of the two is applicable, then you can select not applicable. Following that, we would like to know the scope of the advice, so the type of questions that are asked. So if your advice relates to quality questions, then you select yes. We would like to have a summary of the issues to be discussed. And then we would like to have some more information on what the submission with quality questions includes. The same applies for non-clinical. And some extra information related to non-clinical and clinical advice. As you can see, for clinical, we have a few more fields to be filled in. So clinical questions include trial phases, age ranges, trial design types, trial scopes, These fields are all mandatory because they help us identify the best expertise to deal with your request for advice. Then we would like to know if this is a pediatric only advice, yes or no. Also, we would like to know if your request is related to an abbreviated development product. So you can either select conditional marketing authorization or exceptional circumstances. If none of the two is applicable, then you can select not applicable. If you are requesting in consultation with other stakeholders like WHO, FDA, both, or any other stakeholder, you can provide this information here. And we would also like to know the planned legal basis for the future regulatory procedure. If your request includes post-authorization studies, you can provide this information in this section. So by clicking yes, all these fields are enabled. You can select the type of marketing authorization, if it's a multi-company study, yes or no, the objective of the study, the description of the study, and then the category. Once all this section is filled in, you click Save and Return to complete the section and proceed with the next one. If your request is a parallel consultation with UNETA, you can let us know in this section. So by clicking yes, you are asked to fill in the remaining fields. So if the request includes economic analysis, yes or no, your consent for us to share documents with UNETA, if there are any trials ongoing, new mechanism of action, life-threatening or chronically debilitating disease, and if there is an unmet need, any comments can be entered here. As with all application, save and return, and you go back to the next section. Of course, if you select no, you do not need to fill in this section. In documents from applicant, you're expected to upload the draft briefing document. This is the same submission process as in the previous, as with the current process. So we still expect the draft briefing document to be submitted at the time of submission. So IRIS is replacing the current letter of intent. So you can add any files here. I will not add any files at this moment, but you can choose files from your computer and add any files. Once you have uploaded any files that you would like to share with us, you can click on confirm, and then by save and return, we are almost at the end of the application. In this folder, documents from EMA, you will see any documents that we will share with you following submission. So there is nothing in this section at this moment in time, and you do not need, as you can see, to enter anything. So once you have completed the whole application, there is a declaration. This is with regards to the applicable fees. So I understand that the applicable fee will be due on the date of administrative validation, and also that the fee will be charged to the applicant. So if you tick and confirm by clicking on save and return, we can go to the last part of submit application. You can also see here there is a generate application form. If you click on this button, there is the application form is created and saved in documents from applicant. This is for if you would like to have it for archiving purposes. By clicking on submit application, you can confirm that you're the person authorized to sign this application on behalf of the sponsor. And by clicking on the submit application button, you will also have another prompt if you're sure that you want to confirm your submission. You can review your application if you would like to do so, if you're not sure. Otherwise, by clicking on submit, the application is submitted and received at the EMA's end. I will now proceed with a demonstration of the other types of processes. So we have seen an initial scientific advice. I will now select a follow-up scientific advice. I have prepared already the first part. I will only show you the differences between submission types, not to waste your time with repeating information. So the administrative information is exactly the same as with the previous process. This has already been filled in for the purposes of this training. So for follow-ups, what we would like to know is what was the previous advice on which you are following up to. So here, by clicking on the lookup, you will be able to find a list of previous advices. So if you select the correct one, you will have the RPI already pre-populated and the areas of advice, agreed scope and agreed condition, since a follow-up needs to fill in these requirements in order to be able to be qualified as a follow-up. So by clicking on save and return, it allows you to edit all the other sections. I will not go through all the sections again, as they're exactly the same as in the previous process, but it is important for you to know that for follow-ups there is this requirement, the selection of the previous advice. So I will go back to the draft submissions to demonstrate an initial protocol assistance. Again, for the purposes of this training, the first part has been already completed. So as you can see, in the initial protocol assistance, there is no request for the primary RPI, but there is a request for the orphan designation, which is linked to the applicant's RPI. So you can see you have two options here. If the designation has already been decided and received by the European Commission, and you select yes, you are prompted to enter the orphan designation number. So here you will see a list of all the orphan designation numbers assigned to your location. By clicking save and return, you complete this section. If the designation number is not yet available, but a positive opinion was received by the comp, which means that the orphan designation is going to be received by the time of start of procedure, in order to facilitate, not to delay applications for orphan drugs. We are also giving you the option to select no and let us know which is the ongoing application. There is none in this UAT environment, but here you would be able to see the list of applications that are ongoing, and you can select this and proceed, and then inform us on the orphan designation number once this is received and before the start of procedure. So I will go with the previous options in order to save and return. The remaining information is exactly the same as for the initial scientific advice, so I will not go through all the sections again. So I will also demonstrate the follow-up protocol assistance. This is very similar to the follow-up scientific advice. So by selecting previous advice, here you will also be asked if you have an orphan designation as for the initial protocol assistance or not, and you will have then to indicate the ongoing application. This is required because you might have a follow-up protocol assistance for an initial scientific advice, which means that you received your orphan designation after the initial advice, and that's why you are prompted again to enter the orphan designation number. So once you enter this, of course, there is an RPI associated and the relevant areas of advice. The remaining sections are exactly the same as for any other procedure. I will now demonstrate an initial qualification procedure. This is slightly different than the previous, as there are differences, especially in the scientific fields. So the administrative information is exactly the same, and this has already been filled in. So here you need to select the primary RPI for this submission. I would like to inform you that RPIs that are not for a single medicinal product, including fixed dose combinations, but are for multiple products or a technology or a methodology, then you will need to request this RPI not through IRIS, but by sending an email to scientificadvice@ema.europa.eu and letting us know that you require an RPI for a specific methodology. So when you have selected the RPI, then of course you will need to, if you want to provide some additional information, you can do so in this page. Same applies for the enabling technologies, and this is exactly the same as for scientific advice. Same applies for procedure and information, requirement for a preparatory meeting, yes or no, and any information on previous advice received. We also have a couple of questions on previous FDA qualification given to this biomarker or method, or previous discussions at the pharmacogenomics working party or other CHMP working parties. We would also like to know if you have an additional qualification request plan, and you can inform us by entering a date here. Then we go on to the section of scientific information. Here you can select if this regards a qualification opinion or advice, the context of the biomarker or method. Here you're asked to outline the scope content of your questions. Pediatric advice, only advice, yes or no. The purpose of the biomarker, the type, some information on the types of questions, information on consultation with external stakeholders, and some information on the intended legal basis. Then we proceed with documents from applicant. This is exactly the same as for scientific advice in any other process. So you add any files by clicking on this button, and then you confirm. And of course, the declaration, as this is also a fee attracting process. So once the whole form is filled in, you can again submit your application, and it will be received by the EMA. I would also like to draw your attention to the submissions. You have your draft submissions, your ongoing submissions. You can check here your ongoing submissions, their submission status. Here you also have the option to view and edit submission contributors and managers. Once an application is submitted, you can view it, but you cannot edit if it's not requested by the EMA. So if the EMA asks you to make a modification, then the portal will be reopened, and you will have some time to modify your application. And this you can do so by clicking here on view and edit. And you also have your completed submissions for your information. This is with regards to the demonstration of all the process type in scientific advice. Thank you very much for your attention and have a lovely day.
Thank you, Tarita. To conclude this training session, if you remember nothing else, please remember this. Read the guidance, which is available on the IRIS portal homepage. The IRIS Guide for Applicants of Scientific Application is the guide that will help you to submit a scientific advice application. For an overview of the registration process, refer to the quick interactive guide. And if you need more detailed information about the registration, then check the IRIS Guide to Registration. All of these guides are available on the IRIS homepage. We also encourage you to visit the IRIS forums that we continuously update with the new information on IRIS, including new features and frequently asked questions. And if you cannot find the support you need in the IRIS guidance or in the forums, then contact the EMA service desk. The EMA service desk is the only channel through which you will be able to get technical assistance with IRIS registration or use of the IRIS platform. The scientific advice mailbox can be used for questions related to the scientific advice request business process. Thank you for your attention. We hope that you found this session informative and worthwhile. As mentioned, this training session will be published on the EMA website in a couple of weeks. And if you like to share your feedback on this or anything else, then please do write to us at iris@ema.europa.eu. Thank you. Goodbye.